Hi, everyone. This is Dr. Christina Rahm, and I am here with Dr. Annabelle Morgan. And she is one of the top scientists in her field in cannabis. She has a PhD from Vanderbilt. She's also a dear friend of mine, like a sister to me, and a coworker that has impacted people all over the world. And so as research scientists, both of us are dedicated to working with each other and working around each other to really help with people all over the world. So thank you, Annabelle, for being here. You're a delight.
Thank you for having me. I think this is long overdue.
Oh, yeah.
So thank you for having me. I think this is going to be really special because even for me, it's very rare that I get to speak to another scientist, but another scientist that is so much like me. With your family life, with your crazy husband.
And your crazy husband. I love your husband.
Like me. I love your husband too.
And I love Gramps Morgan. I literally, but Clayton maybe be a little crazier than Gramps. Let me just say that.
Yeah, it's a good balance. It's a good balance.
But I have to tell you, I want to say this. Clayton Thomas loves you. And you guys can understand each other.
Yes, we can.
Yeah.
And so I think we relate to each other with our kids and our experiences in life and definitely the way we were raised as well.
Yeah.
And so it's so rare and so special that we get to talk today. Because we never catch up with one another. We
never catch up. And being a research scientist, everyone doesn't understand what I do. So you're the first. You make me feel normal. Like when people are like, how do you have DRC Ventures and all these products and brands? Well, I'm a scientist.
Yes.
I'm just using different formulas. My whole thing is this. You make me feel normal. Thank you, because I don't feel normal.
Thank you.
Being able to understand someone that does have children, you have more than me. Let me point that out to everyone. That does have children. I had someone one time say that they weren't my 4 biological children. I do have 4 biological children.
I've got 5, so just a little
and I
bit
interviewed
extra.
a doctor from Vanderbilt yesterday who's amazing, who has 6.
Oh, no way.
OBGYN.
There we go.
There we go.
Normalizing it.
And she doesn't have to travel like us, but she works very, very hard, and she contributes a lot. But you make me feel normal because you do different things. You do business. You do science. When this all started, I said I wanted to be there for you, and I told you what I wanted. And I also said people are going to be jealous of you. You're going to be attacked, and I'm here because it's hard. It's not going to be easy if this is the path you want to do. It's a lot easier going to work in a lab or for a pharmaceutical or for a university. This is a little bit harder.
Yes, it is.
Because you're attacked a little bit more and you're criticized, especially being a woman that's multifaceted. So thank you for being here today.
You see how big he got? You guys
I
are
can't get
hoping
over.
him.
Yes, I know. I'm like, what? What happened?
Yeah.
And that's your youngest. What?
He's 4 now.
Annabelle.
Time.
Well, you having more?
Are you going to have more?
No.
If you have more, I'll have more. In another life. I wish
In
I had
another life.
Yeah.
Clay and I've talked
Time
about
is
it.
like, ooh.
Yeah.
Y'all would have had too smart of a kid.
I know. Well, I don't mean to. Clay's so smart.
No.
Yeah.
No, he's
one of the smartest human beings.
he is a smart human.
Like, his sister was here, right? Last
And you
week.
said she's very smart.
Oh my gosh, they are off the chart.
Both of them.
The whole family. So they
Where's
just.
that come from?
I think his mom and his dad. Like his
Really?
dad, I think was in one of the first classes that graduated as a veterinarian.
Oh, no way.
From Washington State, which is their big. That's one of the top agriculture schools.
Okay.
In the United States, and his dad actually did a project where he dissected a complete cow.
No
And
way.
they have
His
it-
dad?
Like, yeah, and they have it in the middle of Washington State, that cow that his dad did for his final project. Yeah,
How
they preserved
amazing.
it. So it's like in the middle of the veterinarian school.
Oh my gosh.
So he's super smart, and then they're super athletic too. So it's a very athletic, smart
And is
family.
it just the 2 of them?
No, they've got a brother, so he's got a younger brother, and then his mom and dad. So they both ran a veterinarian practice that was a big game veterinarian practice. So people flew in from all
So
over
where
the
was
world.
it?
In Washington.
In Washington.
In the prairie in Rochester. So they had about 50 acres.
Oh,
Yeah.
how beautiful.
And then they
that's
had-
what Clay grew up around?
Yeah, so
Wow.
they didn't actually have tons of animals. They had dogs and cats, but they had all the animals because they were constantly working. You know, veterinarians, it's a hard job.
Oh my god!
Did you know that they never
I
sleep?
do know that.
Yeah.
Yeah, I actually have a friend who has a. I'd love for you to meet her. They're out in Switzerland, so they do horses.
Yeah,
and, like
his
bigger
parents
animals.
did too. Yeah,
Yeah, the bigger animals.
Yeah.
It's tougher.
yeah. They did all kinds of like exotic animals, big animals, and
That's
then
amazing.
they worked really hard. And I think one of the reasons Clay and I, because we're so different, but why we work together, is I grew up in a all my family was very educated, but we owned farms. And so
I didn't know
on
that.
both sides, yeah. On my dad's side, they were tobacco farmers
What?
and cotton and everything in Kentucky. Yeah,
Okay.
my grandfather and 2 grandmothers went to Vanderbilt to Peabody for masters. Yeah.
I didn't know
Yeah,
that.
oh yeah. My grandmother Merritt played basketball and tennis. And
Your grandmother's Merritt.
yes. And then my grandmother Rahm's last name was Kreider. So all my kids are named after family names.
Got it.
So, but I grew up with this really hard work ethic. And my dad had been, when I was really little, the coach, principal of the school, and was, basketball, football. So I was raised in an environment probably like you, like when Clay heard you say to your son, get back out there, you're not hurt. When you're raised by coaches or by people that have worked really hard, you're just raised that you have to keep going.
You have to go.
You don't just stop.
Yeah.
And I think it's been one of the biggest assets of my life. I mean, it's like when I met your parents.
Nothing
Annabelle,
stops you. Yeah.
No, I could see you and your parents. And
You
I know,
could?
Yeah. And I know they're different from you, but I could feel where you came from when I met both of them.
Oh, thank
and that's
you.
why it really hit me when your dad died, because they were so close and they made you.
Yeah.
And they are amazing because of that. And even though I don't know Clay's parents really well, I love them, I don't know them, but I'm thankful to them because they made Clay, because he's so different.
And I really appreciate that, because I think a lot of times we don't glorify the root enough.
No, we don't. We don't glorify, like, so this is something interesting about me I've never told you. I actually, when I pray to my ancestors. I pray to my grandmothers and my great-grandmothers and to Clayton's. And if you ask me why, because I'm honoring that. It's a thread that goes through all of us that we can't forget. And even though it may be a painful thread at times, it's because our families, right, are not perfect. And they're full of controversy and pain, and there's good and bad in everyone. We always forget that when we have a mother and father, they were growing too. They were learning too. And so the older I've gotten, the more mistakes I've made as a parent, even though I love my kids so much.
Yep.
I'm not perfect, right? I work a lot.
Yep.
I try to give them time when I'm with them. We try to support them. Every year, at the end of the year, we do a recap of what their best things are, and then we do a thing at the beginning of the year on how we can support our kids.
I love it.
And how we can support their dreams. And I'm not saying that we're perfect parents, but we're trying our best to really guide them and lead them. And I see all the mistakes I've made, and then it makes me remember, oh yeah, I was upset with my mom, but she was just trying to make it. Like,
yeah.
My mom's a music teacher. Well, she's a musician. She majored in classical piano and cello. I think you know this, but she worked constantly like I do.
Really?
Oh, yeah. And so did my dad. So for me, I wish I would have given them more grace. Like, I wish I would have understood. They've been together since they were 14 and 15. They used to fight a lot. My dad went to Vietnam. He would get mad. She was sensitive. Like, but they loved each other. And that thread, I look back now at the times I blamed them. And I was like, they were just trying to make me as good as they could make me, and they weren't perfect either.
No.
Do you know what I mean?
No, that's such a huge statement. And I think about that so much, because I'm like, I don't do what my mom did or my dad did, but what I did see was two parents that were constantly just doing.
Yeah.
And constantly
That's how
going.
I saw. That's what I saw.
And then with my mom, there was never a complaint.
Yeah, my mom was the same way.
And
she
you
worked
know it's
constantly,
there.
and she's completely opposite of me.
And you know it's
Yeah,
there, right? Like
yeah.
you know there's pain.
Oh, I
you know
look
there's
back,
frustration.
Of course.
You know there's bills. You know all of that.
Of course.
And my mom just kept going.
That's how my mom
And
was.
unfortunately, you don't realize that as a kid. But thankfully, we can realize it now and use it and honor it.
Yeah, and I want to honor it, because I feel like I was not the easiest child. I was very stubborn.
Were you?
Oh, yeah, very opinionated. I grew up in a small town, very small. So, Annabelle, I knew I wasn't going to stay there. Nothing against my town.
Sure, me too.
But I knew at a very young age, so I didn't understand dressing a certain way. There were only white people in my town, and I didn't understand that. Like, there were so many things, because I look back now, I read so much that I was... Like, for third grade, I asked for National Geographic. Do you know what I mean? And I asked for a thesaurus. And I was really into just reading as many things as I could. My oldest son, Duquesne, is like that. So I think, for me, I had a different viewpoint at almost all times than my mother. My father, because he went to Vietnam and had traveled and had a job where he traveled, and I related more, right? She couldn't put her arms around how I think, and she still can't always do that, but I have such respect for her because she worked so hard.
Yep.
She loved me, and I'm not like her, but
Yeah.
I never realized how much she sacrificed until now.
Oh my
for
goodness.
us.
Yeah.
I
Yeah.
mean, my mom sacrificed a lot. She had a beautiful voice. She was great at everything. She settled down in a small town and raised us. And let's give kudos to that. I mean, I'm being really honest. That's why when women that work are upset, my mom didn't have a life, just so you know, Annabelle, where there were cleaning ladies and cooks. Like, we are lucky because we've worked so hard and we have the ability to have that, right?
Sure.
So I would say this. That's where we talked about this earlier. I get frustrated because I'm working constantly and I don't have time for petty stuff, right? Like little stuff, because I've got so much to do.
Right.
And so many things about the mission to accomplish that I can't. But I'm fortunate that I do have the ability to have assistance. And I look back at my mother's life, and she wasn't a stay-at-home mom that had everything done for her. And I'm not talking bad about stay-at-home moms that do.
Right.
I'm just saying mine didn't.
Right.
She didn't have that.
Right.
We got up at 5:30, and we had either we're on the farm or she was cooking. We had Bible study. It never ended for my mother. I'm like, how did she do that? It never ended. She worked taking care of us or doing piano lessons to this day. So my mom's 83, and she's teaching 12 piano lessons a week.
Now?
Now, Joy went with me to Dexter, so we filmed the piano lessons. And every person, you can ask Joy before you leave, what they said is they wanted my mom to teach, not just because of music, but she's the best human they've ever met. They kept saying that to Joy.
And she's probably really loving it, which is
She actually
important.
pays them if they do their lessons.
Oh my goodness.
And she has
Oh my gosh.
like in that town.
A
like
true saint.
Yeah.
She is a true saint.
That's where I get how I am. Like my dad
Yeah.
did the Special Olympics. We had to work on it every year. Like I had such great parents, like
Yeah.
that really showed us giving back. And like you and Gramps, and I think Clayton and we give back. You guys give back,
Yeah,
right?
we
And
have
not
to.
and not that we're bragging about it, but you have to.
You have to. We're too blessed, and I think me and you talked about it earlier. You know, I think a lot of people see us in this position and just think that we have people that work for us and
Yep.
do things for us, so it's problem free or maybe easier than someone else's life, and that's actually not true.
No.
You know, heavy is the head who wears the crown.
Oh, yeah.
Extremely heavy.
It's
and
very
we
heavy.
don't we don't have time to complain about it or to take a day off because we don't feel good today.
No.
You know, we don't have time for that because we have a huge ecosystem depending on us.
Yeah.
And so, you know, thinking more and more about like all of this stuff that I push to other people, do I do it for myself? Do I utilize this need for having a balanced lifestyle with my health, my food, my workouts,
Yeah.
my mental
Yeah.
peace? Do I preach it to others? Do I do it for me?
Well, that's been my problem last year. We talked about that. Like,
Yeah.
I'm done this year. I have to. It's interesting. Someone reached out and said, "I heard that you have cancer," and I'm like, "I've had cancer since I was 26." It's like your son, or Kreider. My son is. Once you've had cancer or there's been an illness,
Yep.
it doesn't completely go away.
You're more susceptible
You're
to...
on a journey,
Yep,
right?
you're on a journey.
And so, but I'm actually not overwhelmed with that journey. Like I understand it. I don't like gossip around it, and I don't like sensationalism. Like it's factual that, but I do like to share with people that there's alternatives to basic medicine, right? There's
Sure.
all kinds of things you can do. But from my perspective, I don't even want the gossip or the chaos. Like that doesn't slow me down because I'm having an issue with my health. But it does make me aware of the fact that, yes, I'm important too. Why am I not working out? Why am I not eating? Why am I not getting up to go to the bathroom? So yesterday, I got here in the morning, got home at 7. Do you get this, Annabelle? I realized I hadn't used the bathroom all day, which you know is really horrible.
Yeah.
But I'd never got up and was able to go to the bathroom until
Just to
I got
go to the
home.
bathroom.
Just to go to the bathroom. And honestly, that's when I'm like, Christina, you said this year was going to be different. You got to do that. But if you ask me, was I upset about that last night? No, I had a great day. It was meeting after meeting. I never had 5 minutes to go to the bathroom. I also didn't have time to eat, right? But the group brought me food and tried to get me to eat. I took one
Picked
bite.
away
You know how it is.
Yep,
You went
yep.
on to so I think that's one of the things that's hard for me. People see me on social, or they see something about me in a magazine or wherever. It's like with you, but they don't understand I'm really working hard. I am not a person I'm taking the trash out of the home if I need to. Yes, do we have people that can help us? Yes, but we still do it.
We still do it.
Like
We're
this
still
weekend,
moms.
I did 7 loads of laundry. And we have someone help us. She's amazing at our house. But if you said, why did I have to? Because Kreider had left all of his clothes in his car and upstairs. And I just was like, Clayton was like, don't worry about it. I'm like, I'm just going to do it. It was piles. It was like when I was Kreider's age. Annabelle.
You're like, he's like this because of me.
No, I'm like, I remember one year in college, I didn't do my clothes for a whole semester.
Yeah.
So I brought them home to my mom.
And no one else is really going to do that but you in the way that it needs to be done.
I know. Do you
Especially
know sometimes
for
I
your
want to
son.
do it?
Yeah, yeah.
Do you understand that sometimes
No.
I want to cook? I don't want someone else to do my dishes
Yeah.
or my laundry. It was an interesting thing, so you'll identify with this. So we have people do flowers in the office or at the home because we always
Sure.
have company. Like we have someone coming in from Mobile, Alabama, that was a psychologist I worked with for years.
Cool.
Today. So we have that. But one of my favorite things is doing flowers, wildflowers, throughout the house. And I would put
Wow.
them in the bathroom. So this weekend, Clayton was gone. You know, sometimes it's good to not have your husband at home.
That's right. I second that.
Like, sometimes you just want to light a candle.
Yes.
and
Sometimes I just
have
want
a
to
bath
breathe.
and
Yes.
breathe.
Absolutely.
Talk to your kids one-on-one.
Yeah.
But go to bed. I think every woman can identify with that a little bit. And if you
Absolutely.
can't, then maybe you're a little too codependent because you need some of that. So Clay's in Vegas. I was supposed to go. We had too much here, so he went. I was a little worried about Clayton in Vegas alone, but
But hey.
so I was having such a great day, and all I did was cook all day. I did laundry and I did flowers, and I was so happy to do flowers.
Satisfied.
And I was sitting there and I was thinking, I can't believe I let someone else in my life do one of my favorite things, which is flowers.
The flowers.
But here's the thing, and I realized it had been, Annabelle, probably 6-7 months since I've ever, and I used to do them all the time, but I've been so busy and I haven't been home.
Yeah.
Like we took September, you've been through this. I can't complain to you because we both travel so much.
You're not complaining.
No, I'm not complaining. But I'm like, wait a minute. Why? It hit me. Why am I having someone else do something I love? And then it hit me really quick because you don't have time.
Because it might not get done.
Yeah.
And you want to
So-
see them.
So
You want to see those
But it brought me
flowers.
happiness.
Yeah.
You know what I
It's
mean?
Very simple.
Very, very simple.
Very satisfying. And I think that's that too. You know, you talked about not having time to go to the bathroom, but you had a great day. And that wouldn't make sense to a lot of people. But I think to us, satisfaction and good mental health is
Yeah.
getting things done.
I accomplished a lot towards the mission that we have. That's a good
right.
day to me.
That's right. And
Yeah.
and understanding that, yeah, the sacrifice might be that I don't get a full meal. The sacrifice might be that I don't get to sit on the toilet for 10 minutes. I mean,
Yeah.
but it's okay. I think that's where we're very much alike.
It is okay. Yeah.
It's okay because guess what? I don't have this big project laying on my shoulders that I've been holding off because I
Exactly.
accidentally scheduled an hour and a half lunch when I should
Yeah.
have been working on that project. So even though you said, okay, this year I'm going to spend more time at home, I'm going to do more things with my family. This year I'm going to just be more intentional about maybe taking my time.
Yeah. I just
Are we
wanna-
really wired like that? You know, is the way that
Well, when I
think.
say stay home, for me, here's what happened with my career. I don't know if this has ever happened with you. I started traveling more as a humanitarian, right, and going and meeting with presidents and prime ministers and his highnesses and sheikhs, and it was worth it because we had this plan, right, because we were
Sure.
opening manufacturing. And then I was getting ready to do art research and development with the state of South Carolina and their colleges. So we knew that. You know how it is. You have
Yep.
this plan, and then but people see what they see from the outside, and then on the inside, this is what you're doing.
They don't see the substance.
No.
Yeah.
Because they don't know the reason you're in a gown in Dubai or in Saudi Arabia.
Because wouldn't everybody be?
Yeah. And
What
by
did
the
you
way,
put on that gown?
by the way, we don't always want to wear dresses. Like, let's tell the truth.
Absolutely
You and
not.
I would rather be in a sports outfit half
Hat
the
and
time.
sneakers,
Yeah,
yes.
yeah. And that's the reality.
Yep.
But there's also the other side of our job, right? Because to
Yep.
be, and I say this all the time, when we met, if you remember this, I said this, there's a lot of scientists. There's a lot of doctors, and they do great jobs. But if you want to be a person making a global impact, you also have to understand the business side.
Yes.
And you have to be involved in the business.
Yes.
And that's a hard lift, right? But it's a lift that's worth it, because I want to say this again, because I say it a lot. Women sometimes have a different way of looking at things. And no, not all women are the same. But some of us have a gift of multitasking
Yes.
and of looking at things a little bit differently, which is why I wish you would go into politics so that you could help our government.
Me?
Yeah. Well, you need good women.
Yes.
I want to formally invite you, for example, to May 6th. Elysium is inviting certain women
Okay.
to their event to speak and to be given an award, and I nominated you.
Oh my gosh.
Yeah.
No,
So-
you didn't.
Yes, I did.
Thank you.
Yes, I did. It's in Spartanburg, and they have a lot of people coming from all over the world
May
to the
6th.
meeting. Yeah.
Thank
so
you.
those are things, though, that if you say to us, why are they going to that meeting? These women are coming together to support each other, regardless
Absolutely.
of their religion, color, their political preference. They're going to bring 150 women from the United States and 150 women international to work
Okay.
together towards empowerment of women and towards making, and some of them are different scientists like us. Some of them are governors, lieutenant governors. We will have men there. Gramps is welcome to come to support the women
Yeah.
that are going to create this circle to work together to empower each other in whatever jobs they have and in their businesses and careers.
So needed.
Yeah.
So needed.
And you've got some of the top people in this country doing that.
Okay.
And so I'm nominating certain women to be a part of that so that we can step up, and then we're going to also empower younger women
Yeah.
and keep growing this. That's part of not me being a scientist or a mother or an artist. That's part of me wanting to contribute to other women in the world, and I get to make that decision. And is it an extra thing that I'm doing? Yes, and it's a needed thing that I'm doing. So when I say I'm stepping back, that's me supporting a mission. Like we do some stuff with child trafficking and with kids that have been abused. A lot of people do, and we need more people that are doing it sincerely. Not to say they're doing it, but to actually really help these kids. And I know there's amazing people out there. My goal this year is to do a little bit less writing checks for that. Still write checks, right?
Sure.
Because it's important.
We get other people on board.
But to get other people more
Bring-
and really
bring awareness.
right, and
Yep.
really be dedicated to that. It was really hard last year. I can't run R&D and manufacturing when I'm not in the United States, if it's the United States.
Sure.
That's why I said that, because if you ask me, am I doing less this year? Oh, no.
No.
We just bought our main manufacturer, and I'm the CEO
Right.
over the
And
manufacturing.
the CEO should be around a little bit.
A little bit, and because there's no one else that's done manufacturing. And so I actually went back to Cornell and got a degree in that because I knew I was going to run manufacturing, because you need A to Z and
Yep.
some of this stuff. So that's an extra thing on my shoulders that wasn't there
Planned.
before.
Yeah.
But it was in my 5-year plan. So I
Okay.
have, so every year, Annabelle, I do a end of the year review and a 5-10-year plan, and I keep it. It doesn't mean I accomplish everything, but I got to tell you, I'm pretty on target. But I don't need to tell my plan, and I do tell Clayton.
Sure.
He's always known the plan. I don't have to share that with the world.
Nope.
But I just need to do it, right? What I need to do. But because of that, my husband owns Root. I mean, he's created an amazing opportunity to do business anywhere in 80 countries with legal, with accounting, with shipping, with logistics, with the fintech system.
And that's the business side.
That's the business side.
Yeah.
I am going to step a little bit back from that. I'm going to support Root 100%. They're my products. I'm going to bring in some other products. I would love to bring in something you're doing.
Yes.
And then I'd love it for us to do some other projects together, because here's the truth. Root is a foundational piece that I'm so thankful for and I support, but Root isn't my life.
Right.
You know, it is an amazing company with amazing people that I will always contribute to. But this year I will be one of the founders and the chief formulator, right? But I'm not going to be the chief scientist.
Sure.
And I am not going to be the CEO of that company because we had too many other things to do.
Yeah.
So it's just a restructuring. I'm sure you do this every year.
Yeah.
Your years are probably, like, what is a typical year? I'd love for people to hear this. I'd
Oh
love
my
to hear
gosh.
this.
A typical year?
You don't have a typical year, I
Which
bet.
year?
That's what I'm saying. There's not,
no
because you and I are
typical year.
very similar. That's what
Yeah.
I mean. Yeah.
I would say that the core mission, right, of bringing, which is now, how do we take science, as incredible as it is, and make it applicable, you know, naturally? How do we educate? How do we not say, oh, I'm not into big pharma and pharmaceuticals? How do we just understand time and place?
Yeah.
Because it's not the fact that I don't want to be in academia or I don't want to work for a pharmaceutical company, which most scientists like us do.
Most scientists do, yeah.
It's that I want to take what I've learned there
Yeah.
and normalize it in just a better way.
That's
and
like,
you have to do that.
Me. Yeah.
To me, you have to do that globally.
Yeah.
Because in all of my discovery, what I've learned is whether it's in Morocco or Korea or Israel or Canada or here, I've learned so many different things that in some way we're very much aligned. And a lot of scientists, and I've told you the last time I came, it's been really important for me to keep scientists around because it keeps me sharp. If we're the ones out there, we're the ones kind of course, first dealing with our family and then contributing to this nonprofit and then going to our kids' games and then trying to figure out a better material. If we're the ones forward-facing and also having to think about the business, the science of it, which is the root, if you can get a nice handful of scientists on board who understand the scientific mission, then you could have experts there.
Right. It's really important. I told you it was a weakness of mine.
Yeah.
Because, and I got to tell you, it's the biggest thing that's hard for me since I left pharma, right? I've never had, because pharma has more money.
Yeah.
And so we had groups of scientists, and I love working in groups. Yeah. So I am not a scientist that just wants to work by myself. I enjoy teams. You know, I played sports. I enjoy it. I enjoy the collaboration. When we were scientists in pharma and biotech, there really wasn't a competition.
Never.
We were working together towards a solution.
One solution.
Yeah.
And it's almost like you need each other.
You need each
right?
other. Well, like, you have to have each other almost.
Yep. It's like one big whiteboard. It's a constant conversation. And it's what I love about science is the team aspect of it. But then the further and further you get from academia and going to lab every day and biotech and going to lab every day, the farther and farther you get from that, you start to forget about certain mechanisms.
100%.
And you just
100%.
start, and you're not talking, because that's its own language, you're not talking cascade effect and those, because we've worked so hard to translate.
Gosh, like the psoriatic cascade, which is causes
we don't think about
psoriasis.
That. Don't
I
ask
haven't
me
talked
about
that in years.
But guess what? If I have my friend Greg, who's a scientist beside me, who does think about that every day, and he can kind of just tap me in and remind me, because our job, I think, is translating that difficult science to the world so that they can personalize their own path and understand their own health and the genetics of that. And that's precision medicine. That's taking something natural and having it be a preventative in someone's day-to-day life, right? There's always going to be a place. For me, there's always going to be a place for pharmaceuticals.
There's always going to be a place
I don't think that'll go away,
and
right?
I you know, that was my career. So for me,
I mean, you've had to use them, right? My son's had to depend on, rely on them for seizures.
Annabelle, we have babies. Some of us have to have babies in a hospital. I'm just going to remind everyone. So if anyone wants to know where anesthetic, when you have anesthesia, that came from Johns Hopkins.
Yep.
The doctors there developed anesthesia. The main guy that developed anesthesia did it the first time on his mom because his mom was going to die.
I didn't know that.
You have to read the book about Johns Hopkins.
Yeah.
It's about the founders. It was really kind of sad because a bunch of them got addicted to it because they were testing it on their own. On
themselves.
Yeah, and it's addictive. You know, you can't just do it. It's like if you use fentanyl. You know, if you use an opioid, you can't keep doing that, and they didn't know that.
Sure.
And so it's really kind of sad that the founders, a bunch of the founders, I think it was 6 or 7, it may have been more, got addicted because they didn't know. But they weren't trying to do anything wrong. They were trying to advance science.
Sure.
You know how we try it on ourselves. But you said something, I have to say this. Thank you for saying, like, every time I'm around you, I wish I could take you with me. That's one of my things. I always only could talk scientific language. So when I worked at pharma and biotech, I'm working with the top doctors, insurance companies, and countries in the world, right? Because you launch a drug usually first in the United States, and then you go into other countries. So my whole discussion every day, all day, for 15, 18 years of my life was just science talk, top level. Because if you're working biotech, human monoclonal antibodies, cloning, you're being exposed to the cutting edge science of the world. Alexion to this day, like I go to Cornell, I'm studying pharmaceutical manufacturing. Everyone are like major people, right, are in my class because who wants to take time to study manufacturing unless it's applying to your job or you need.
Sure.
So we're sitting there, and the whole case study for the whole class was Alexion. And it was so interesting because, I was one of the first people at Alexion.
Yeah.
And we did Solaris, eculizumab, and we couldn't launch it for AHUS because it didn't work. We failed when we went to the FDA. So we pivoted and went to PNH, proximal nocturnal hemoglobinuria.
Oh, you spent a lot of money.
We spent a lot of money. They spent a lot of money.
They spent a lot of money.
But we went down in history as making the most money. In an industry, because what we did, it was $500,000 to $800,000 a year, but it stopped PNH. So those thrombotic events, most people would die within 5 years. So we were able to justify that expense because if you could get rid of PNH, then you don't have a stroke, thrombotic event, death, et cetera. You have to prove right to the insurance companies why they're going to pay for it. My whole life was talking the science talk. That was it. There was no basics. Then I go to
You didn't have to think about the company.
No.
You didn't have to think about your employees.
No. Now,
Yeah.
I'm trying to bring science to a basic because I understand you have to bring it to an 8th grade level. Did you know that in order for people to understand what you're saying?
I have an 8th grader. I think it's a little lower than an 8th grade level.
I think so too. Which I'm not upset about that. Most people just don't know medicine or science.
Right.
But then it hit me the other day because people were talking about me talking more scientifically. That's really easy if I start doing that.
Right. But am I connecting to you?
But am I connecting?
Do you understand?
Yeah.
And does the greater population understand? Because I'll tell you what, I've had conversations, and I think you probably find this too. The more you get out there, people want to introduce you to other doctors.
Yeah.
And no offense to medical doctors, ODs, chiropractors, but we're not the same.
We're scientists.
We're
I say I'm a
scientists.
research clinical scientist.
Right.
I don't know.
But people don't even know the difference of that
I
because
know.
they communicate with doctors and pharmacists and nurses and chiropractors on a day-to-day basis. So when they meet us, we're not in the public eye.
No, people aren't used to us because most of us are in
and a lot
lab.
of what we talk about, sometimes we can't even translate to the medical doctors.
No, I get
because we're
frustrated.
too scientific, right? And it like so in my
Do
book,
you know?
Mighty
I have to
Flower-
tell you this. That was one of our main things in pharma. We had training after training, Annabelle, day after day, how we take our information and translate it for a doctor. And I'm not cutting doctors down at all, but it was too here
like translating
for
language.
doctors to understand because doctors are diagnosing. I try to tell people this. A diagnosis is a diagnosis. It's a guess from a tool book of what you think is typical for a person.
from a checklist.
From a checklist. And
Yeah.
everybody has a...
Do you check these boxes? Okay, then you have this.
Do you know that
And you
the
take
majority
this.
of public does not know that? They think they go and they get a diagnosis and that's a fact, and there's no outside factor. What if the person didn't sleep that night? What if they don't know what they're doing in that profession? Anyway, that's
And your blood work yesterday could be different today,
today.
right?
Get that.
And so this diagnosis puts us in a box.
In a box, and scientists that are research scientists, I tried to explain this again and again. I've spent my life going back to school or learning, as a research scientist. It doesn't end for me, and
No.
that's how I'm different. So how do I translate that into when you go to school, you learn something and you diagnose and treat all day, one patient after another. Amazing job, amazing people that are doctors. I am not taking any credit away from that, but
Right.
we don't do the same thing.
We just think
Nor do
differently.
they have the knowledge I do in the area because
Right.
of how I'm looking at it, what I've been trained, what I do.
Right.
So we spent so much time trying to figure out how we, I don't want to say dumb down, but how we translated what we
Translate.
knew to doctors. So then I've gone this way even more. And that's why
And
when
then
the
help the doctors
So
explain
how
it
do
to
we
the
have a discussion
patient.
with the medical doctor? I do better with PharmDs, by the way,
Oh, yeah.
because they understand mechanism of
mechanism.
action and steady state, and they
Yeah.
understand that a nutraceutical will have a peak plasma in a steady state.
They understand that.
A
They
medical
understand
doctor
those
will say, "What do you
toxicities."
mean?"
Yeah.
Well, okay, retin A is just a vitamin,
Mm-hmm.
right, that has a synthetic component. Vitamins, minerals, plant seeds, oils, they do have steady states, peak plasma. There's different components to that. It's just not as regulated. I appreciate you bringing that up because that is one of the obstacles I have. How do I explain this to a medical doctor? I do much better, again, explaining it to a PharmD.
PharmD.
Yeah.
Yeah. And I think that's, I call it the upstairs, downstairs effect. When I was at Vandy, here we are in the cancer center. All the research was done at the top level,
Yeah.
right? So we had amazing, beautiful
Always has
labs,
been,
right?
yeah.
But then when I walked through the door every day, it was people receiving chemotherapy, radiation treatment. And I'd almost just look at them. 7 years every day. I'd almost just look at them and then just go right upstairs to my lab. And can you believe that in 7 years, I didn't ever meet a single physician, oncologist. I didn't know what they were giving these patients, what the protocols were. Yet we were studying groundbreaking
Yeah.
chemotherapy.
Isn't that, I've always
so
tried to
we
explain that's
never-
crazy. It's crazy.
And so Vanderbilt, I will tell you, they and Brigham Young and right around that time, Yale and a lot of these different programs, they were trying to implement translational science.
Yeah.
So they were forcing medical students to spend 6 months in a lab.
Yep.
They were forcing, PhD candidates to take their project and look at what we're seeing in an animal. How do you translate that? Go shadow a doctor, right? So they were trying to develop that translational science portion more and more. But when we did rounds just a few times where you would have to take scientists, biologists, and put them in the room with cardiologists for 1 hour, it's like there were just never questions because we weren't ever really on the same page. We couldn't translate what we were seeing in cardiomyocytes to what cardiologists were seeing in patients.
Right.
It was just so
far away.
It was so far
It's
away.
so far, because also another thing people don't know is research scientists are trying to come up with something clinically that's better or innovative that doesn't have as many side effects or has a different implementation or a different mechanism of action or uses another pathway that's safer and more efficacious, whereas doctors are treating, right, based on the tools that they have. Again, one person's not more, better than another, but I think that's why in Europe and the Middle East, for example, and in some places in Asia, if you're a PhD research scientist, to them, it's considered the highest. And that's why when people ask me, well,
Yeah,
why are these
they show
presidents or
levels.
prime ministers asking you to meet with them? Basically, they want to talk to me about information and the latest research and what I understand, because they're not interested in going to someone traditionally when they're looking for something better. I'm just being honest. So then
They want to move the needle.
they want to move the
They
needle.
want to move. And I think that's where I've grown so much is going to speak to leaders, going to
too.
speak
Yeah.
globally, because not only do I get to understand where they are, I can compare it, and then I can even introduce scientists and teach them that, hey, your science is impactful today, not in that textbook.
Right.
Today, we have to start thinking about getting funding for what we could put on the shelf.
Oh, like that's what I've been
Opposed
working on for 2 years, the
oh,
funding.
let's just solve this mechanism. To go where? To do what?
Yeah.
We're going to just have textbooks all day long without understanding therapeutic application.
Yeah.
So I feel like
Just so you know, the medical textbooks haven't changed a lot.
I have
Did you
no
know
idea. No.
No.
And
Yeah,
that's not good.
Look, I'm getting ready to do a podcast with the president of Kesman University in Africa. And they're trying to get the president of the country to get on too. So we're working on this right now.
Oh, that'll be good.
Yeah.
That'll be so interesting.
But I got a medical degree there. Did I take my medical exam here? No. Am I going to treat patients? No. That's not what I do. But
you wanted to learn.
I wanted to learn, and I helped them develop the program. No cadaver labs, no accreditation. They are accredited now by their government, which is why I want the president on. But
that's cool.
It's a different environment. But if you ask me, did I learn as much there as here? Yes, it's different. Yeah. There's some similarities, but there's different approaches. Like for there, if someone has a parasite and they use a turmeric curcumin to help get rid of it by putting it on a wound, or black cumin seed, or ivermectin, right, for parasites.
Yes.
While all those doctors were doing that there during the pandemic, for example, we're doing it here this way. I'm not saying one way is right or wrong, but why not share all that knowledge?
Why aren't we collaborating?
Yeah.
Yeah.
Why not? And because for me, I want to know all the countries, not just my country, just so you know.
Absolutely. And where all of these incredible compounds come from.
Oh, yeah. They know more information, just so I know you know this, in some of these countries about natural things than we do here.
Absolutely. And you can still go into certain villages and places where they're living till 95 years old.
I know.
And so for me, it's kind of like I've just been really lucky to go to a lot of these places and learn from people that don't speak the same language as me, but they can show me a plant, they can take it off, they can go like this, they can show me that, okay, I boil a tea or I do this, and I'm like, how do we make that real today? Well, okay, I could just scientifically justify it.
Yeah.
The only thing that is keeping them from making that popular and new mainstream over the counter is that they don't know how to check the boxes that an FDA would like to look at. We do. We know how to check those boxes. Yeah,
they just don't know. They know
so
it works.
So it's up to us to take that ancient wisdom and make it into modern medicine today. Because we can't lose that wisdom.
Right.
And it is being lost.
It's being lost. On Zero N, I've worked on a lot of adaptogenics, nootropics in my life. Zero N is probably my favorite. And it had a velvet bean pine bark. And before I started working on it, so I've explained this to people. When you work on something, you use prior art, like what you've learned.
Period.
From other scientists. That's why if you can have friends that are scientists and collaborate, it's better because you both bring your knowledge. And just so everybody also knows, our knowledge is different. And we know that, right?
Yep.
And we're trying to learn from each other. It's kind of like if I make spaghetti at home, it's going to be different than yours because we have different knowledge.
But it doesn't mean they're not both delicious.
Doesn't mean they're not both delicious. And so pine bark velvet bean, to source it and to work with it, because it's a hallucinogenic if you use too much, and it's only available in two places in the world where I sourced it. How did I know that? Because I traveled there. Do you know what I mean?
Yes.
I went there. Well, why don't other scientists know it? Some do. I just experienced it myself because they showed me what it could do to help people that were having issues mentally, emotionally, and physically. So this is why I travel so much.
I love that you said that because think about your training, okay? And then think about walking into the lab and think about looking at all these labeled, right, containers. And we use them all every day, right, from sodium chlorides to all of them. And we take them and we're using them to formulate or to start an experiment, whatever have you. But as a scientist, that's what you see. Now think about where me and you have been. And now seeing that those same drugs with isolated compounds are actually in these incredible plants.
I know.
Right? And it's like, oh, wait, so why am I afraid of cannabis or mushrooms or any of that stuff when it's actually, honestly, the same thing? This is actually going to be more readily naturally occurring than that in a powdered form that's sitting on the shelf. But at the same time, I think of it as time and place, and it's expanded my scientific mind to be able to see it like that instead of in a chemical formula.
Oh, for me too. But I think if I would have just ended my education and not traveled and gone on and learned, and I'll say this, You don't have to sit in a class to learn. If you're a scientist and you're traveling and meeting with other scientists, like the last 2 years have worked with the Vatican. I'm not Catholic. John was Catholic. I'm not, but I had the kids in Catholic school for a long time. I was raised just Protestant.
Okay.
I don't really, the religion thing for me, and I say this a lot, I'm exposed to a lot of different religions, and I understand people have different beliefs. The Vatican, though, what people don't understand, that I want to make sure people understand, they have every plant, every seed, every leaf. I don't know if you know this, within the Vatican walls in the world.
I had no idea.
Yeah, in the world. They bring so they've traveled everywhere and brought it
So
all
they
back.
go everywhere. Are they growing, or what
They're
are they?
trying to grow some of it too, and now they have a science codification. I want to bring you into that world as well, because for me, what I've learned, some of the information's been good. Some I'm scared that it's new science that maybe could not be. As scientists, we know this. You develop something. Let me use an example: a virus you put in a flea or a tick or a mosquito. Someone said to me the other day, "What? It was a doctor, actually. It was, I want to introduce, she went to Vanderbilt. She was like, what do you mean I go, they've done that for years. Like, I wrote a book. I'll have to give it to you. I think we have one here. It's not interesting, but it's called Military Science. It's not that great. We did launch it at the Kennedy Center with the Congress and the legislature. We gave books, and I did a book signing. But it's about military science. I wrote it years ago when I was in school, and I incorporated biological warfare as a scientist and how we've developed this throughout the world.
Wow.
So I hear statements on the news or in these different conspiracy theories or whatever.
Sure.
For example, Ukraine has all the biological labs. I'm like, listen, I've been to Ukraine and Russia and all over the world, in most countries. Even in the Middle East, like I used to do, we had projects in Iraq, Iran, Uganda, right? Have places where they're developing biologics. And not all biologics are bad. I want to say that for everyone. Not all retroviruses are bad. Not all vaccines are horrible. Here's what I'm going to say. It's a more complicated story than that. And as scientists, to innovate, to try to solve things, you're working on constant innovation and constant new formulations. And so you do have labs that if things get out, it would not be positive.
Sure.
And countries have all worked in the military. And I guess I think I've been exposed to too much at this point, because
it feels like that sometimes.
I'm not upset about that. I understand that. Like I'm not condoning it. I just understand that if you're protecting a country, just like some countries have nuclear bombs, I'm not for nuclear bombs.
Right.
But I understand this is part of the defense system that countries put together. So I realized yesterday, because this was such an educated and amazing doctor, gosh, since my 20s, I've been exposed to cutting edge research. Like when we would take animal organs and hearts from cows and sheep and put them into humans, right? Worked for a while, then the hearts would burst. But those people that we put them in would have died that day if we didn't do it in the countries we were in. So here's my thing. Most scientists are really trying to do something good. I understand that some scientists have gotten a bad name because they were involved in things that people think were destructive.
Sure.
But I would say most scientists don't do that. Most scientists are trying to innovate. And this technology for me, again, because I've been exposed to so much all over the world, I think it's hard for me. Like when I hear conspiracy theory, I'm like, I've never heard that. I don't think that's true. Let me use an example. The virus was released somewhere for countries to take human beings down. Maybe that's true. I don't know if it's true. What I do know is we have developed different things in different countries, including our own country. And I don't feel like our goal as scientists have ever been destruction. I feel like things happen. I don't know about the government because I'm not here to judge the government, but there's a thread of truth in conspiracy theories, right?
Yep.
And so I feel like when those come out, I know what the truth is, and then I know when it's exaggerated, because there's facts that are being said about science that we don't know for sure, we're assuming. But as a scientist in my position, traveling throughout the world, I have been exposed to stuff that I would think 99.9% of all the doctors have not seen, MDs, right?
I would agree with you, and I do think that one thing that I've learned is, like, as a scientist, you're expected to explain so much in an hour. or in a book. And the truth is
And you
when
can't.
you hear those conspiracy theories, and sure, there may be like bits and pieces of it, but the story is so much more complex and so much deeper. And when you think about being a scientist, a lot of times you might have your specific aim and you're going towards that, but like you had said, you're building up research from others to craft that aim. But then when you dive into your own research, you may say, oh my God, it actually does this.
Yeah.
And then you start fueling a new aim, and that's constant.
That's constant. I told someone this about the patents I've written. I'm never, like, there's a patent in 2016 that was assigned to another company. I don't really use it anyway right now, because here's what happens, and I know this happens to you. What I knew in 2015 and 16 is completely different than what I know now.
Yep.
And that's what I think people find confusing about me. Well, in 2015, you thought that. Why don't you think that in 2025? Because my opinion has changed because I've been exposed to too much. And when I write a patent or a process, if I haven't gone into the lab and done it, tell me how much that's going to change.
Yeah, and it's
Huge
ever
change.
changing.
It's always
ever
changing.
So 10 years from now, it's going to
be different.
It's going to be different. And so when I think about my son, and I think about, like, he actually started having seizures again. And I started thinking about, like, okay, he's missing 38% of his brain. I shifted from all his pharmaceuticals, all the seizure medications, to just everything natural. And as much as I'm thinking to myself that I know what mechanism I'm going down, I know I'm trying to attack this still developing brain, right? Neurogenesis until the age of 22, 25.
Yeah.
So I still want to take advantage of that. Neuroplasticity.
Oh, yeah.
Right? Neuroinflammation and tackling that, all because he had a surgery. So surely there's some neuroinflammation there. And as much as we try to create one thing for something, it really is like, think about when you're writing on the wall and you're trying to solve one mechanism. It's arrows and inhibition because one little enzyme can come in the way.
Oh, yeah.
Right? And it's the same thing with medicine and with plant medicine. It's never perfect.
It's never perfect. And then I say this too. Yes, I have formulations that I use, but I also use other things like CBD.
Yeah.
I'll tell you this. You know this and I know this. The research around cannabis and what it does for cancer and what it does with even wound healing. Like I could go in a million directions to show how it can help people. Mm-hmm. And if you said to me, but you don't have what I have, Christina, I would say, you're absolutely right. Let me try what you have, right? And teach me more about this.
Yes.
You would say to me, okay, like for clean slate, right? To detox the body. I never get jealous or upset or think I have the only answer.
There's not one
There's
answer.
not one answer.
There's not one answer.
I can't explain that to people.
And
Everyone's
it's kind of
different.
like telling people, right? It's kind of like telling people, like, oh, my skin's got so much better since I purchased this new peptide skin formulation, right?
Yeah.
Well, is it the formula, or is it because you started eating better, or is it because now you're working out? It's really all a combination. It's an embodiment, right? So when you think about,
it's so great that you said that.
How do I help myself?
Yeah.
I've come over here and I've asked for a clean slate.
Yeah.
And I've dropped off
Well,
CBD.
I asked you to help me with my nose.
Why?
Like I was
and
like,
help you with your nose. I mean, it's because when you're attacking something, especially cancer, and what I learned,
cancer can be tricky, and you may have to change what you were doing before.
Cancer has a mind in itself.
Thank you.
Right, mind of
so
its
you
own.
you gotta start trying.
You're playing
everything.
a game with it.
Yeah,
you're playing a game with it. You start a chemotherapy, and you use something natural to help you deal with those side effects. Yeah. All of a sudden, this chemotherapy is not working. Why? Because the cancer's clever.
The cancer's so smart. I tell people it's like viruses. So smart.
And that's why personalized medicine
fascinated
is so
with it.
important.
Yeah.
You're fascinated with it.
I am.
And you can't be afraid of it.
I'm not afraid. It's really interesting how I look at it. When this really shifted for me as a scientist was when I worked on HIV and Hep C.
I remember
when
you
I
saying
started
that.
understanding, my mission started like yours because of my children. And because of wanting to help my children and my family and going through cancer and Lyme disease and just trying to deal with it. But my fascination and my respect, this is going to sound very odd to some people, for like viruses and colonies and cancer and the way it develops. When I started understanding, because I was in the field of oncology,
Yeah.
I started understanding that it's just a different way of the cells developing, right? And the cancer cells look different. The majority of the public doesn't know that, right? So I started being kind of not in awe, but it hit me one day, oh my gosh, God made all of this. And like, I'm trying to understand all of this. And I have a respect, I know that sounds odd, of understanding a virus and maybe that's because I threw my life into science, I don't know, or cancer. And how can I be smarter than the virus and the cancer? How do I not give up? How do I fix it? And I wish sometimes there was more of me or you, Annabelle.
Yeah.
Because if you gave me a situation, like if it's my father, my mother, me, a best friend, my children, I'm going to spend that time. I can't do it for everyone every day.
That's right. And that's, I love that you said that, because I know that you experience the same that I do, where people come to you directly.
Yeah.
And, the first thing I say is, well, I'm not a physician. And what I try to impact, and this is why I don't really speak to other MDs. I don't take the time to talk to other doctors and try to teach them.
It's a long conversation. Yeah,
I try to contribute to those that create their protocols.
Yeah.
I try to create to those making new medicines and administering new medicines, because if we can impact that, then people could start relying on their doctors again.
Yeah.
Right. And really, what the doctors are using every day, it's us.
I know.
That created it. It's us. They got it FDA approved.
I've tried to explain that to people.
Right.
Yeah.
And so it's not really for us to be a physician.
We really shouldn't, because it's
we shouldn't.
We should.
And it's taking away from what our greater impact is going to be.
Yeah, and
but
that's not our jobs.
At the same time, it's really cool to people that they get to meet scientists. I mean, most people meet me and they've never met a scientist before.
I know. They don't really understand, what do you mean
and
you're
they
a
don't
scientist?
understand what that means. And I think it's important for us, as we mentor the next generation coming in, that as a scientist, you shouldn't be stuck in a box. No. You shouldn't be thinking about one project. You shouldn't be thinking.
Well,
you shouldn't be
true
labeling
scientists
yourself.
are not jealous of each other. I'm going to be really. If you're really a true scientist, you're not competing with a doctor. You're not competing with another
You're
scientist.
having incredible conversations.
You're truly trying to take their knowledge and your knowledge and create something that will better our world, right?
Absolutely.
So I explain it all the time. Every patent, every literature review, every white paper, every case study, it's not just one scientist or doctor.
Nope.
It is a combination of years of research, and I am so thankful God gave me a brain that I can fit things together from the lab, from my career, from my education, from my travels, from my exposure to other scientists, where I can help people.
Well, that's what makes you the most unique. And that's, if I can say this on camera, I'm going to say this. It's that first day that we met, and I was going through what I was going through with my son, and I shared that story with you, and I shared wanting to be more out there.
Yeah.
Because if I never did that for my kid, he would probably be tied to the wheelchair and non-responsive. And I have a normal 9-year-old boy. And so when I met you, I was like, how do you do the business side of this? Should I go consult for these companies? Should I, and
I remember the exact
I'll never
conversation.
forget talking to you and using your advice.
Because
I
saw you, Annabelle.
Right, and think about protecting myself, because as scientists, we are in a box where we get a task and we do it, and we try to do it to the best of our ability, and we use the little bit of funding that we have. But when you get out there, it's a scary world.
It's hard.
It's a scary world, and you have to understand how to protect yourself, and you have to understand how to honor that you have a gift that a lot of people will want to use.
Yeah.
And if it's not being used in a way that is going to impact your mission, then maybe it doesn't make a lot of sense. And it's taken me years to realize that.
Yeah. Well, I remember when I met you, and I said this to you, I don't know if you remember this, you had the ability to make an impact not on one organization, but on the world because of your knowledge, who you were, your background, your ability to walk into a room and handle it. There's not a lot of scientists, and I told you this because I've worked with them throughout my career that can do all those things, because most scientists are really introverted, because think about it, their minds are constantly, it never stops.
Yep.
When I'm doing an interview, and I know that it's not, when I say if someone loses me while I'm doing an interview, then no one's going to listen to that. Or the majority of people aren't, right? Because my mind can easily get distracted because I have a million things to do. But I understand that my biggest thing to do is to create this ability to help the world as a scientist and then communicate it. And that's where I saw that in you, because and I told you this, I hadn't met a lot of scientists, and the world has to have scientists like you, Annabelle.
Amen.
Because if you don't have scientists like you, then the work we do as research scientists will never be disseminated to this world. That means we travel. That means we speak in large environments. That means if we don't want to go to a meeting, but you have the most influential people in the world there that want to ask a question, we go.
Yeah.
Because we owe that to ourselves, our families, the world. We owe the fact that we take the time to understand a virus or cancer and to understand how we can fight it and deal with it, because the battle, and I say this, the battle's never done. It's not over. We live in a world where we're not just getting smarter, but where all these things like viruses and bacteria and parasites are getting smarter too.
Yes.
They think too. They think too. Can I just tell everyone that? They're living. They're communicating. They're living. I tell people that all the time. So it's not a 9-to-5 job. It's not a 5-day-a-week job.
No.
It doesn't end.
And let me highlight that if we don't do this work, and if we don't make a path for other scientists to understand that this is a real lane, if we don't do it, I mean, I have an aunt right now, terminal bone cancer, and I went up to Canada to say goodbye to her because they gave her 48 hours to live. And I look bedside and I see these natural pills that she has beside her bed. And so I'm asking my cousin, what is this? Has she been using this? And yeah, it's from a holistic doctor in the Philippines, and it has placenta, and it has this, and it has that. And I'm looking at it. And as a scientist, you just know before you know.
Yeah. Oh, yeah.
You just
know.
And then I looked at the capsule, and then I'm like, you're not packing all that in here. Placenta's living.
Oh, yeah.
So I start thinking about every little ingredient that they put in here, and the stories and the lies that are on the markets and that's on the market and that people are selling. And I think to myself, if we aren't a part of this conversation, then this demand for people that they have where they want to get better and they want to take advantage of being educated, where is that education coming from? If we don't do it, if we don't put our stamp of approval,
had placenta in it. Did she think that?
It says it has placenta in it.
Well, come on. Yeah.
But how do they know?
They don't know.
I mean, I couldn't tell you the first thing that starts a car. I don't know anything
I
about
understand.
a damn
I'm not
car
blaming.
engine, right? But that's the thing.
Yeah.
You can sell it to me if I believe you.
Yeah.
I'm going to buy it, right? And that's what's happening in our nutraceutical world.
It works both ways, right? I tell people all the time, you're upset about pharmaceuticals? Let's look at nutraceuticals.
Our nutraceutical world,
like,
sure, we got to make our pharmaceutical world better. There's no doubt.
There's no doubt, yeah.
But our nutraceutical world needs more scientific justification, right? There's got to be standards there.
There's got to be more, because typically, and I know people don't know this, but when you're making a product in a manufacturing, which is why we took it over.
The manufacturing, yeah.
I have processes and different things I do that are important to the success and delivery, bioavailability, efficacious, and safety. Mm-hmm. If I'm not there all the time or not checking on it all the time and owning it, it's hard to know if everything's happening.
Yep.
But the truth is, there's a lot of nutraceuticals out there that are just like vitamins that have never been cleaned. They're holding on to heavy metals, because I don't know if you know this, but vitamins and minerals hold on to heavy metals.
Oh, absolutely.
And so plants and leaves and our GMOs here, like if you ask me how I source, It's a lot of work, all the different components. And if you don't have scientists that really want to make nutraceuticals and pharmaceuticals better, then we don't have advancements in health and wellness. That's just a fact.
And essentially, it has to be the same sort of process.
It does.
Right?
It does.
I mean, the level of testing, it's not one certificate of analysis.
No.
It's constant. And so, I do feel a very strong responsibility to make the nutraceutical space better. Because there's a lot, in cannabis, you call it snake oil. And there's testimony after testimony of people using certain products and certain extracts. And sure, I mean, by all means, I'm not saying those aren't real stories, but I have a real story too.
Yeah.
I'm still trying to ensure the safety of these formulas.
Right.
Because just because they're natural, it doesn't mean that there won't be drug interactions.
Oh, I know.
And at certain doses, CBD, for instance, can be harmful.
Yeah,
more so than
doses,
beneficial.
So can clean slate, right?
Right. So if you just fall into this world of, well, it's natural, I can use it, and I'm just going to pound this many milligrams of turmeric and this many milligrams of, then you're going about it the wrong way,
You are.
right? And who's going to influence that space if it's not actual scientists?
Yeah.
So we have a job.
We have a job, a big job. I think we have to end, but Annabelle, I
Thank
know
you
you're
so
Dr. Morgan,
much.
but I have to say this. You are one of the most influential people in this world in your space.
Thank you.
There's a huge need for it because you have touched and saved not just your son, and I know that's hard to hear, or hopefully you found peace with that, because if you weren't in his life, I'm sure it would not be the way it is. And a lot of people's lives have been impacted. You have a big mission to do for the rest of your life, and I will be rooting you on.
And I will be rooting you on. And you're my sister, and I really hope you know that a lot of what I do, I get strength because I see you doing it too.
I do the same thing. I look at your stuff all the time.
There she goes. All right, I'll get on an 18-hour flight too.
I was like, because when Clayton was like, Annabelle works as much as you do, I go, I know. It's a lot.
Yeah, but we need each other.
We do.
And so thank you for being who you are in my life.
Thank you for being my friend and for being my sister. I say that to
Yes.
people. I go, Annabelle's more than a scientist to me and more than a friend. So thank you.
Absolutely.
Thank you.
You.